Chapter 14, Integumentary System. So first, we're going to briefly go over the function and structures of the integumentary system, primarily the skin. So when we look at functions of the skin, one thing to look at is it has a variety of functions here. Number one, protection. So protection shields against physical barriers, chemicals, biologic hazards, any kind of pathogens, any kind of particles that cause disease. Water resistance, so it prevents dehydration by retaining body fluid, prevents water from leaking into out of the tissues. Temperature regulation through sweat and blood vessel dilation. This is primarily involved with regulating, the homeostatic balance of temperature. You have vitamin D synthesis. So the skin is primarily essential not only for protection against these pathogens, toxins, hazards, but also it's important for vitamin D production. And vitamin D itself is a very important element that's important for bone health, immunity, and overall general health. Sensation is another. So it contains a lot of these tactile receptors for touch, pain, temperature regulation. So it's responsible for detecting touch, pressure, heat, cold, pain, vibration, any kind of tissue injury, and also social function, right? So the skin can convey some kind of emotions like blushing. So for example, if the skin reddens when you're embarrassed or mad, the skin becomes pale when we're frightened or ill, the facial skin wrinkles when we don't like something, any kind of expressions, goosebumps occur when we're cold, right? So all these different things can happen as a generalized social function. Now here's a fun fact. The skin is the largest and most vulnerable organ in the body. It's constantly exposed to environmental challenges, making its protection mechanism vital for survival. The skin receives more care and treatment than any other body system. And it makes sense too, because it's the largest organ that's exposed to the highest amount of stress. Let's look at some word definitions. So if we see the word cutaneous, this means pertaining to the skin. Dermis is the connective tissue layer of the skin beneath the epidermis. And then squamous cell. Squamous is a scale-like or flat epithelial cells. Let's do some terminology. So we look at what is the practice of dermatology. Dermatology is the study and treatment of the integumentary system. What is the name of the medical professional who treats disease of the skin? Dermatologist. Now, if we were to basically define any kind of differences between the dermis and the epidermis, the dermis is connective tissue layer of the skin, which is deep. It's beneath the epidermis. And epidermis is the outermost layer, which is referred to as epithelial tissue. Functions of the epidermis. So now we're going to go into different layers of the skin and its respective function. The epidermis provides a waterproof barrier and protects the underlying tissue. Its outermost cells are continuously shedding and being replaced because it's exposed to all these environmental hazards. So just imagine the resilience required to withstand all these pollution and daily wear and tear. The epidermis is the outermost layer of the skin. That's really important. So it's exposed directly to the atmosphere. And the skin cells are continually shedding and renewing throughout the person's lifetime. Epidermis structure. So the epidermis structure is broken down into 4 to 5 layers, depending on which region. The deepest layer, we're going to start out with the stratum basale. As we go towards the superficial surface, we have the stratum spinosum. Next, the stratum granulosum, the stratum lucidum, which is primarily found in thick skin. Where would you find thick skin? The palms and soles of your feet. So if it's not thick skin, if it's not the palms or soles of your feet, this individual layer, this stratum lucidum, is actually absent. In thick skin, it is present. Stratum corneum is the most superficial. This is the layer that is primarily dead cells and is exposed to the atmosphere. So here is an image basically defining the different layers. So if we start off with the most outer layer, stratum corneum, is the outermost layer of the epidermis. It's composed of keratinized, stratified squamous epithelium. These are dead, nucleus-free cells that we shed regularly. Think of them as dandruff from your scalp. The protein keratin makes the layer tough and protective, and is also primary component of hair and nail. In thick skin, which is the presence of the stratum lucidum, we have that's present. This layer, that's a translucent layer, is just an additional layer of protection due to any kind of instances of high friction regions, right? So your palms and soles are going to be exposed to more mechanical work, probably going to be exposed to more high friction regions. So it's a protective layer. The granulosa layer or the granular layer, this is where you have primarily the specialized type of keratin producing cells called keratinocytes that produce a fatty substance that coat the surface of the cells, creating this waterproof barrier essential for retaining moisture. The stratum spinosum, deep relative to the granulosum, also contains keratinocytes with nuclei. These cells are firmly connected by the spiny projection, hence the word spinosum, which gives the epidermis its strength and resilience. The last and deepest layer is the stratum basale. This layer is made up of a single row of cells that form new keratinocytes. This layer also has a high concentration of melanocytes. Melanocytes are melanin producing cells. What's melanin? Melanin is a polymer, a protein that's responsible for absorbing ultraviolet radiation, as well as responsible for generating pigment for the skin. So that was the epidermis. Now we are on the dermis. The dermis, primarily made of connective tissue, is a thick layer of connective tissue located beneath the epidermis consisting primarily of collagen. Collagen is a structural protein that provides both strength and flexibility to the skin, enabling it to withstand daily wear and tear while maintaining resilience. This layer is well supplied with blood vessels, sweat glands, nerves, hair follicles, and nails. The next layer, deepest layer, hypodermis, which is technically not part of the skin itself, because when you think about the skin, you're only thinking about the epidermis and the dermis. The hypodermis now is directly below the dermis, so deep relative to the dermis, and it's responsible for anchoring the skin to the muscle and bone, respectively, right? So it provides important cushioning and insulation. Hypodermis is also called the subcutaneous layer, so below the skin layer. And another name for it that is primarily used is called the superficial fascia. Superficial fascia means basically superficial to a type of connective tissue encapsulating muscle called fascia. So superficial fascia will be the third name. This layer contains a high concentration of adipose tissue, which plays a crucial role in energy storage and insulation. What is adipose tissue? Adipose tissue is, in simpler terms, just fat. All right, so it plays a big role of storing energy in the form of lipids, and it helps insulate the body to maintain body temperature, right? Besides insulation, adipose tissue in the hypodermis protects internal organs from external force. So it can also play as a big role as shock absorption. It also helps contour the body and provides some mobility for the skin over the muscle. Accessory skin organs. So now we're going to be looking at the actual skin. You have the hair follicle. Hair follicle basically anchors the hair and are surrounded by the sebaceous gland or oil gland that produces sebum to lubricate the skin. The sebaceous gland's primary role is to prevent dryness and protect the skin. Hair characteristic like texture and color are influenced by genetics as well as hormones. Hair texture is primarily determined by the shape in its cross section. So, for example, when you have straight hair and curly hair, straight hair has a round cross section, whereas curly hair has an oval cross section. Now, the natural color of hair comes from two pigments derived from melanin. Variations in melanin production influenced by genetics, age, hormones, environmental parameters create a spectrum of hair colors. So, for example, the word alopecia, what is that? It is referred to as the thinning of hair, which can occur due to aging, due to genetic factors, or as a result of hormonal changes, as well as medical conditions. With here, for example, you learned body regions from the previous chapters. If I were to ask you, where can you find axillary hair? Where would that be found? Take a moment. Axillary hair is grown under the armpits, right? And here it becomes prominent primarily after puberty, often associated with sweat glands, these regions. Now, when we look here, during our evolutionary process, hair served a very important purpose, right? It plays a big role in trapping heat and preventing dramatic changes in temperature during cold conditions. Over time, as humans developed clothing and living in controlled environments, this function became less critical. So now here, let's focus on word inspections. So I want you to identify the roots, noun, singular, and plural, and adjective in the following words. Okay, so you can take a moment, try to do this on your own. If not, you could follow along. So the root in this term is core, referring to the outer layer of an organ. It is commonly used in medical terminology to describe the structure of a layer. So if you break down the term, let's analyze the term related to core provided on the slides below. So you have cortex, cortices, and cortical. Cortex is the noun referring to the outer layer of the organ. So for example, cerebral cortex in the brain. Cortices is the plural form of cortex and is used referring to multiple outer layers or structures. Cortical is the adjective form of the noun and is used to describe something related to or pertaining to the cortex, such as, for example, cortical tissue or cortical gland or adrenal cortex, right? So these are different examples of that. Now, here we also have other accessory structures as we call glands, specifically exocrine glands. Exocrine glands that are found, in this case, the different types of sweat glands or exocrine glands here. You have merocrine glands. Merocrine glands are the most common type of sweat gland, also referred to as eccrine glands. These are found majority all over your body, right? And they're concentrated in the palms, soles, and the forehead. These glands produce a watery sweat, right? And 95% of it is primarily water and electrolytes. Their main role is thermal regulation. Apocrine are located in areas that are including armpits, groins, and around nipples. They secrete a thicker, cloudier sweat that contains lipids and proteins. These secretions with bacteria on the surface produce body odor, or another way of looking at it, pheromones. What are pheromones? Pheromones are these chemical messengers found in these apocrine glands that can generate attraction. And remember too, apocrine glands are activated during stress, emotional reactions, and primarily puberty. You have ceruminous glands. Ceruminous glands are specialized sweat glands found only in the external ear canal. They produce cerumen or earwax. Earwax protects the ears by trapping dirt, dust, and other foreign particles and has antibacterial properties. Mammary glands are specialized sweat glands that are part of the female reproductive system. They are responsible for producing and secreting milk to nourish the infant during lactation. All right, looking at this image, one thing I want you to do on your own is try to point out the different types of glands. Other accessory organs we have right here are the nails. We're looking at other accessory organs of the integumentary system. Now we look at the nails. Okay, the they have these nail plates, is the hard visible part of the nail. Beneath the nail plate is the nail bed, which provides support and nourishment. The lunula is the pale crescent. Lunula basically means moon, crescent-shaped area at the base of the nail. Surrounding the nail is the eponychium, better known as the cuticles, which protects the nail's matrix from infection. Nails are formed from the stratum corneum, which is, if you remember from the previous slide, the outer layer of the epidermis. Like hair, nails are composed of keratin, making them strong and resilient. Fingernails grow at an average of about 1 millimeter per week, though the rate may vary depending on the age, health, and nutritional status. The eponychium, or cuticle, act as a protective seal, preventing pathogens and irritants from entering the area where new nail cells are forming. Word elements. So it says, identify and define the root of the following words. All right, let's focus here. The root is crin, which means to secrete. The prefix is apple, which means separate from or away from. So together, apocrine is a gland that secretes their product by pinching off a portion of the cell, as seen in sweat glands located in areas like the armpits and the groins. Pheromones. Now let's take a break. Now let's break down the word pheromones. The root, hormones, which means to excite or stimulate. Prefix is phero, which means to carry. A pheromone is a chemical signal secreted by one individual that stimulates a response in another, often related to behavioral or reproduction. Disorders of the skin. So now we're going to look at some pathology of the skin here. So you have squamous cell carcinoma. Okay, so this originates in the stratum spinosum layer of the epidermis, where keratinocytes are actively providing structural support. When you look at the appearance, squamous cell carcinoma typically appears as a flattened, right? Squamous, that's the word. Squamous means flat, reddish or brownish plaque. It can have a rough, scaly, or crusted surface, making it visually distinct from other skin lesions. Typical locations where you can find this in the face, ear, neck, hands, and the scalp. Basal cell carcinoma. This arises from the stratum basale, deepest layer of the epidermis, and it invades the dermis and surrounds epidermal layers. Unlike squamous cell carcinoma, basal cell carcinoma grows slowly and is less likely to metastasize or move to different tissue, but early detection is still important. When we look here, if you look at the pigment, you can see that there is some kind of artificial darkening that takes place because of this basal cell carcinoma. So why is that? Well, if the cells are in the basal layer, and you remember that there is specialized type of cells that produce melanin, like melanocytes, are found there. If they begin to divide rapidly and have their secretion related, you can see this pigmentation. All right. Now, when we look at darkening of the skin, is there a way of, for example, artificially darkening or even lightening your skin? Of course there is, right? People do it all the time. What are some ways of artificially darkening? Well, tanning. So if you expose yourself to a lot of ultraviolet light, this will stimulate melanocytes to produce more melanin, right? So on the other hand, is there a way of lightening your skin? Of course. There are certain ways where certain creams or even laser therapies that will target melanocytes in order to decrease the melanin concentration. Malignant melanoma. So this integumentary disease, right? So this type of cancer, malignant melanoma, very scary. It originates in the stratum basale. This is, again, deepest layer of the epidermis. Specifically, it arises from melanocytes, the cell responsible for producing the pigment melanin. It is rare, but when it is diagnosed, it can be very fatal. Malignant melanoma is the least common form of skin cancer, but is by far the most deadly. It has a very high mortality rate, meaning it kills the easiest, and this is due to the tendency to invading deeper tissues and metastasizing rapidly to other parts of the body, including lymph nodes and internal organ. Decubitus ulcers, or pressure sores, or bed sores, are serious complications, often affecting bedridden or immobile patients. They develop due to constant pressure between body projections, such as the heel or lower spine, and the surface on surfaces like the beds. This pressure reduces the blood flow to the area, leading to tissue damage and eventual ulcerations. Now, if you were to look at it, can anyone identify area of the body that are particularly susceptible to developing these bed sores? For example, heel, elbows, buttocks, or the hips, right? So these regions are going to be very highly susceptible to these decubitus ulcers. Let's look at more roots and combining forms. I want you to identify the root and combining form and then define the term. All right, melanin is the word. Root combining form, melan. Definition, melan means black or dark, referring to a pigment responsible for the coloring of the skin and eyes. Melanin is produced by these melanocytes, as mentioned before, and plays a protective role by absorbing harmful ultraviolet or UV radiation. Melanocyte. So the root combining form is again melan, right? But this, you have a different suffix. It's site. And if you remember, site refers to as either some kind of pigment, in this case, functional cell or mature cell. So a melanocyte is a pigment producing cell located in the stratum basale of the epidermis. These cells stabilize melanin, which determine skin tone and provide ultraviolet protection. Melanoma, what is the root again? Same thing. Melan, which is dark, oma, which is the tumor. A melanoma is a tumor of melanocytes. It is the most dangerous form of skin cancer because of its ability to metastasize rapidly. Let's look at terminology components. So from the following terms, identify the noun, verb, and the adjective. So metastasis, first, is going to be the noun, which means the term referred to as a spread of cancer cells. Metastasize, that would be the verb. The definition is to metastasize means to spread cancer, verb. Example, the cancer has metastasized to the liver. And metastatic, that would be referred to as the adjective. If I were to define this, metastatic describes sometimes relating to or caused by metastasis, such as metastatic tumor in a distant organ. Other diseases, other disorders. Dermatitis. Dermatitis is a skin condition that results in a direct exposure to an irritating agent or substance. It causes inflammation, redness, and often itchiness or discomfort. For example, what can cause itchiness? Well, what we've heard before is allergens. What is an allergen? An allergen is any substance that causes an immune reaction. When an allergen comes into contact with the skin, it can trigger allergic dermatitis, leading to symptoms like itching, redness, and swelling. Let's brainstorm some examples of allergens that might cause allergic dermatitis. Can anyone name a few? Take a second. Common allergen can include, for example, poison ivy, poison oak, latex, certain cosmetics, lotions, soaps, clothing fibers. There's a lot. We can do this forever. Now, another common symptom of dermatitis is pruritus, which is basically referred to as itching. This can range from mild to severe and often exacerbating the condition if scratching leads to further irritation. Other disorders. You have eczema. Eczema is an itchy red rash that sweeps serous fluid, and may become crusted or scaly. Excoriation refers to dry, red, scaly patches. Ichthyosis is an inherited condition of dry, scaly skin. Also, another that's not presented here is allergic dermatitis, which may lead to eczema. More terminology analysis. So here we have defining the root of the following terms. All right, so root is in all the terms is al, which means other or different, and erg means work or action. So together they refer to responsible for different forms of the normal of the different from what is normal and is expected. So breaking down each term, we'll do this together, or you can do this on your own. So you have allergen, root, al is different, gen is producing. Allergen, an allergen is a substance that produces an abnormal immune response. Allergenic, al is different again, genic, causing or producing. Allergenic describes something that has the ability to cause an allergic reaction. Allergy, al, different, ergy, action or process. An allergy is an immune system reaction to a foreign substance that is harmless to most people. Allergic, al, different, ergic, relating to or affected by. Allergic describes a person or response that is sensitive to allergens, such as an allergic reaction. What else? Now, let's look at infections of the skin that are viral. Human papillomavirus, HPV. This virus is responsible for causing warts. HPV invades the epidermis, causing a rapid growth of skin cells that result in warts. These skin growths are typically harmless, but can unsightly or be visually improper or uncomfortable. You have varicella zoster virus. Anybody know where this virus is very common from? If you guys guessed chickenpox, that's the same thing. So varicella zoster virus, VZV, okay? This is chickenpox, usually occurs during childhood, presenting an itchy rash with red spots and fluid-filled blisters. When it gets to adulthood, it becomes herpes zoster or shingle. So elderly people that become immunocompromised will actually display these symptoms of this painful rash that can basically be very, very debilitating depending on what it is. Let's see. Tinea. Tinea refers to a group of related skin infections caused by different species of fungus. These infections affect various parts of the body and are named based on their location. So fungi thrive on the non-living stratum corneum, the outermost layer of the skin, and is derived, it is a derivative like in hair and nail. This explains, for example, why fungal infections are common in these areas. So, for example, we have Tinea pedis is a form of foot is basically is a form of foot fungus, so it's found on the foot, and another name for it is called athlete's foot. So this is very common here. You also have different variations of it. For example, tinea capitis. Capitis is referring to the head. Corporus, this is basically found on the body. Tinea cruris, found in the groin or jock itch. And tinea versicolor, which is found on the trunk of the body. And again, this can cause this discoloration that may basically look a little bit lighter or darker depending on the actual surrounding skin. Other types of fungus or this yeast-like fungus we call Candida. Okay, so Candida is a type of yeast that naturally resides in the body but can cause infections when it grows uncontrollably. Now, can Candida cause recurrent infection? Of course it can. So these infections often occur when immune system is compromised or due to environmental factors that promote fungal growth. One common recurrent infection of Candida is thrush. What is thrush? Thrush is an infection, a fungal infection, specifically with this Candida that affects the mouth, characterized by this, you can see from this image, this white hair-like growth on the tongue and sometimes the inner cheeks or roof of the mouth. So, for example, infants can have this, right, because their immune system hasn't developed, or a lot of elderly, or even certain kinds of patients that are immunocompromised due to this, right? So, people with impaired immune systems, such as those going through chemotherapy, HIV, AIDS, those are different candidates that can have this example of thrush. Okay. Parasites. So what is a parasite? Parasite is an organism that lives on or within a host organism and derives a lot of nutrients from the host at the expense of the host. So parasites can cause a variety of health problems, including skin infestations. What is an infestation? Infestation refers to a presence of a multiplication of these parasites in the body. So unlike infection caused by microbes like bacteria or viruses, infestations are caused usually by organisms such as lice, mites, worms, right? So for example, head lice infestation is one of the most common examples. Lice are small wingless insects that live on human hair and feed on the blood. Okay, so pediculosis refers to as infestation of lice. Common types include head lice, body lice, pubic lice, right? And so different signs and symptoms of this can include intense itching, presence of these nits, so these little lice eggs attached to the hair shaft, and then visible adult lice moving through your clothes. Okay, so this is actually a disease involving primarily these parasites. Now, let's do some word differences. So, an infection occurs when a microorganism, such as a bacteria, virus, fungi, or parasite, invades and multiply within the body, causing damage to tissues or trigger an immune response. For example, bacterial infections like strep throat or viral infections like influenza or the flu. Infestation, on the other hand, refers to the presence of multiplication of larger organisms such as parasites. So lice, mites, worm on or within the body. So example, as we mentioned before, head lice, for example, scabies caused by mites burrowing into the skin. Other examples of parasites. So if you're familiar with house mites or house dust mites, these house dust mites are these microscopic organisms that derive in the household environments such as bedding, carpet, furniture, curtains. These mice feed on dead skin cells shed by humans and pets, making them a constant presence in many homes. So these these have these allergenic properties. House dust mites themselves are not harmful, but their feces and body fragments are potent allergens. These particles can trigger allergic reactions such as sneezing, nasal congestion, asthma, eczema, etc. Where do they thrive? These, as we mentioned, warm and humid environments. These are basically, that's where you'll find those things. Now, how do you prevent these? And in order to minimize these exposures, right? Very simple things, dehumidification, cleaning of your bed, etc. Next, you have different infections of the skin when we look at bacterial. Okay, Staph aureus. So when we look at Staph aureus is cause of a variety of infections. So for the example, they can cause pimples, boils, carbuncles, impetigo, right? Staph aureus is often is short for staph. So staph infection are the most common bacterial infections that invade the skin, right? So here you also have something called necrotizing fasciitis. Basically is a cause when some strain of staph or strep produce enzymes that are very toxic and digest connective tissue and spread into muscular layers. So basically the connective tissue becomes infected. Collagen diseases. So you have three types: SLE, systemic lupus erythematosus, so SLE, rosacea, and scleroderma. Okay, so collagen, first of all, what is collagen? Collagen is a fibrous protein that provides strength, structure, and flexibility to connective tissue throughout the body. Collagen diseases attack collagen or other components of collagen, causing a widespread damage and infection. SLE is an autoimmune disease that's commonly affected in women. Different key features produce these skin lesions and other systemic symptoms. The most common characteristic feature is this butterfly-shaped red rash across both cheeks, joined at the bridge of the nose, right? And so here we can look at this. You have rosacea. Rosacea is a rash that resembles SLE, but is caused by an enlarged capillaries rather than an autoimmune disease. So the main key features is a persistent redness, often on the face, sometimes associated with visible blood vessels and small pustules. Lastly, you have scleroderma. Scleroderma is a chronic, persistent autoimmune disease characterized by hardening and shrinking of the skin, giving it a leathery feel. Key features, most commonly affected by women, and this disease can also attack other organs, including heart, lungs, kidney, digestive tract, and the joints. Other disorders, so for example, you have psoriasis and vitiligo. So psoriasis is a chronic skin condition characterized by itchy, flaky red patches of various size covered by white or silvery scales. It occurs when the immune system speeds up the life cycle of the skin, causing them to accumulate rapidly on the surface. Vitiligo, on the other hand, is a condition that is an autoimmune disease that produces pale, irregular patches on the skin due to the destruction and malfunction of melanocytes, the cells responsible for cell pigmentation. Key comparisons to really look at when we look at these, while both conditions are affecting the skin, they differ in presentation impacts. Psoriasis involves these red, scaly patches. Vitiligo results in loss of pigmentation. Dermatomyositis. So this is an inflammatory condition associated with ovarian cancer. It presents at this reddish purple rash around the eye, sometimes referred to as the heliotropic rash. This rash can also appear over the knuckles, elbows, and knees. What makes the condition particularly significant is that often develop it's basically the characteristic of ovarian cancer in the development within 4 to 5 years. So it serves as a precursory role of early warning signs for this deadly cancer. Nails. Let's look at some disease of the nails. So nails that have become brittle and cracked may indicate underlying issues such as fungal infections, trauma, or systemic conditions. So one thing to know, did you know that 50% of all nail disorders are caused by funguses? Fungal infections often thrive in nails due to moisture and warmth, creating favorable environment. So what activities can lead to continuous moisture or dampening of nails? Here are some examples. If you wash your hands too much, especially without drying them thoroughly, exposure to warm and humid environment, so wearing these special type of gloves for example, for long periods of time, or even poor hygiene. All right. Uh, Paronychium is a bacterial infection of nail folds typically caused by trauma such as biting nails, cutting the cuticles, or exposure to moisture. You also have the most common bacteria for this paronychium is going to be the Staph aureus, which can easily enter through small breaks in the skin and nails. Now, looking here, looking at the nails, nails can also be an indicator of systemic illness. For example, hypoxia, low oxygen. Your nails can basically develop being bluish or clubbing, heart disease or lung disease. Malnutrition can lead to thin, brittle nails or white spots. So these can be signs of connective. These signs can highlight the connection between nail health and overall wellness. Burns and injuries of the skin. So burns can be dangerous because depending on which degree you're looking at. So burns are actually the leading cause of accidental deaths. Severe burns not only damage the skin, but can also lead to life-threatening complications. So the primary threat to these burns can include fluid loss. So severe burns can actually result in dehydration and shock due to loss of protective layer of the skin. Infection, the open wounds left by the burn is highly susceptible to bacterial infections. And then systemic effects of dead tissue. Burned tissue, for example, can release toxins into the bloodstream, potentially leading to organ failure or sepsis. Burns are classified by the depth of tissue damage involved. So, for example, you have first degree, second degree, third degree, and fourth degree. So, if we look at first degree, it affects only the epidermis, causes redness, mildness, and no blistering. So, for example, in this case, would be like sunburn. Second degree, partial thickness, damaged epidermis and parts of the dermis. This results in blistering, swelling, and significant pain. Third and fourth degree. Third degree is full thickness, so it destroys epidermis, dermis, and deeper tissues, often paleness, initially due to nerve damage, and requires certain types of skin grafting. Fourth degree extends into the muscle, bones, and deep tissue. These can actually be very dangerous because it can cause infections not only of the blood, but also of the connective tissue. When we look at burns, there is a tendency of regeneration, but primarily treatment, a lot of times, is going to be some kind of grafting surfaces, grafting or transplantations of the skin. And so here are different types of grafts. This surgical procedure is to treat any kind of burns, wounds, or any kind of skin loss. So let's start off with autograft. Auto, prefix for self. Autograft is a tissue that's taken from the patient's own body. The uniqueness of this characteristic is preventing any kind of rejection, any kind of graft versus host. Homograft basically means same or similar. Homograft is a tissue transplanted from a donor of the same species, usually some kind of cadaver, and is used temporarily while waiting for some kind of permanent solutions like an autograft. Allograft is other or different prefix. Allograft is another term for homograft tissue from another person. So again, those can be used interchangeably. So homograft and allograft are the same terminology used interchangeably. You have xenograft. Xenograft prefix foreign. Xenograft is a tissue transplant from different species, such as pigs, skins, usually for temporary coverage. And then heterograft right here. Prefix hetero also means different or other. Heterograft is another term for xenograft, basically emphasizing that the donor is from a different species. So xenograft and heterograft are used interchangeably. And when we look here, there's different regions of the skin surface area. So looking at this slide, it's basically called the rule of 9. Skin surface area can be divided into 6 regions, each one which is a fraction or multiple of 9 of the total surface. So for example, here you have head and neck associated with 9%, Each arm is 9%. Each So each arm is 9%, and each leg is going to be 18%. So basically a total of 18%. Anterior trunk is 18, posterior trunk is 18, genitalia is 1%. So looking here, other examples, you have lacerations or wounds. These usually can be due to some kind of traumatic injury. And again, a lot of this, depending on what the whole goal is to prevent any kind of infection. So first treat the infection, then there'll be some kind of surgical intervention. Any kind of wound repair or plasty, right? So suturing is basically referred to as a manually bringing the edges of the wounds together to enhance the tissue healing and reduce the risk of infection. Sutural material can be either non-absorbable, absorbable, or liquid adhesives, right? Here also you have a keloid formed when there's excessive fibrosis occurs in a wound, making the scar raised, irregular, and lumpy. Let's see. Now, let's look at some procedures and pharmacology. So here we have different types of diagnostic procedures. Okay. So dioscopy is a microscopic slide is pressed against a lesion to see if it blanches. Usually it's used to find any kind of vascular lesions. You have microscopic examination, examining of the skin, scraping to help diagnose maybe if it's a fungal condition, some kind of parasite like scabies. Cultures. So cultures or swabs of lesions are implanted on a growth medium to diagnose some viruses or bacteria for correct therapy. Biopsies. Biopsies basically are punches or excisions or shaving of a lesion for microscopic examinations. The gold standard for any kind of diagnosis in cases of cancers. Wood light, a black light used to define the borders of a pigment lesion before any kind of excision. These different other type of therapeutic procedures. So these are therapies. Photodynamic therapy. This is used as a high intensity blue light to create a toxic environment where bacteria can't live. Laser therapy used to manage birthmarks, warts, or vascular lesions. Chemical peels uses an acid solution which is applied to the skin to reduce fine facial lines and wrinkles. Cryotherapy use liquid nitrogen sprays to treat acne, scars, and sebaceous plaques. Botox is a prescription medication that blocks signals from the nerve to muscles so that the injected muscles can no longer contract, primarily for cosmetic reasons. Dermal fillers help diminish facial lines and wrinkle. Again, more cosmetic purposes. Let's see. So here you have a list of pharmacological agents. They can be based off of how they want to treat them. And I'm going to go through them real quickly. So you have anesthetics. Basically, this is referred to relieving pain or itching on the surface of the skin. You have antibacterial to destroy bacteria, antifungal to destroy funguses. You have antipyretics, basically to relieve itching. Biologics, that could be a wide variety of chemicals. They can block the immune system, they can make the immune system stronger. Keratolytics. Keratolytics typically are these topical agents that are used for chemical peels. Uh, Parasiticides, basically killing parasites, right? And then you have retinoids. These are basically these form of retinoic acid or vitamin A that is used to basically enhance the skin. Common parts, and again, more identifying the roots and or combining forms and differentiate the two. So pharm is a root for drug or medicine. So pharmacology is the study of drugs. Pharmacologic is pertaining to the study or application of drugs and their effects. Pharmacist is a healthcare professional who prepares and dispenses medications and provides drug-related advice. Pharmacy is a location where medications are prepared, dispensed, and sold.